Ladies and gentlemen, welcome aboard the Pilot Lawyer Podcast. Thank you for your attention while this important legal information is reviewed. What you hear should not replace consultation with an attorney and should not be considered advice for your situation. On behalf of the Pilot Lawyer and your entire crew, it's our pleasure to have you aboard.
Welcome, aviators, to the Pilot Lawyer Podcast with us, the Eisen brothers at the Eisen Law Firm, where aviation law is all we do, nothing else. You're here for what we do best, navigating the FAA Medical Certification process for pilots and those who want to become pilots. Around the office, we live and die by this creed. If you don't laugh, you cry. And for the next 30 minutes, we hope to bring you the lighter side of what can otherwise be a frustrating process. It may not be professional, but
that brings us to the point of today's episode. An individual recently commented on a YouTube video and said that it was painful to listen to us. Painful.
It was painful to read that comment.
So he's gonna have to report that at 18X on his medical application. He's had pain. So anyhow, painful to listen to us. Why don't you learn how to talk like professionals? Is what he said. Or she said.
I didn't get
Why don't
no
you
good
learn
college.
how to talk like professionals? Well, let me say this much. All right. It's in the opening. If you don't want to listen to this, just turn it off. It's no problem. But the idea here is that we're trying to give some levity to we could scare the crap out of you. I guarantee I could scare the crap out of you about your medical certification.
Maybe we should do an episode.
Yeah. Is that what you want? Is that what the listener wants?
We don't have to try. We can.
Yeah.
We can.
Yeah. So certainly, if you want this to be all doom and gloom, we'll have that. Call in. Call 863-712-9475 and you'll vote. That's what we'll do. But
that being said, that guy probably isn't even going to.
He's not even going to listen to this,
so he doesn't even know we're calling him out.
So please, the person that's listening and is still listening at this point, thank you, because you understand that we're just trying to.
He gets it.
Yeah, we're trying to bring the lighter side to an otherwise frustrating process. So that's the whole line there. Otherwise frustrating.
It must not have made it past that.
Yeah.
They couldn't even get to the opening.
The first sentence they didn't think was very professional, and off they.
Well, clearly we're professional when we need to be professional, which is every other minute of every other day. But this is the 30 minutes we take to enjoy talking to each other, and which no one enjoys talking to us generally. So
that being said,
all that's out there.
That
today's
being said,
topic,
and this and
I
that.
want Alex to tell us what today's. We're going to start incorporating. We're getting our money's worth out of Alex.
We're going to talk about PTSD.
What's PTSD stand for?
Post-traumatic stress syndrome.
Disorder.
It's a syndrome too. Hey, you know what?
I'll have to restart this podcast.
You know what? You know what?
I'm not doing that.
I'm not doing that again. So PTSD.
I ain't talking again.
Well, what's new? It turned into a very passive-aggressive episode. So anyhow, PTSD, a lot of folks have it. And the reason a lot of folks have it is because we got a lot of pilots who are veterans of the U.S. Armed Forces. And it seems to me that a lot of folks that are veterans end up having PTSD. They're receiving VA disability benefits for the condition, or they maybe otherwise have the condition. So today we figured we would walk you through the FAA's Guide for Aviation Medical Examiners and give you the understanding that the FAA publishes regarding their triage of what they call disease conditions and dispositions on PTSD. So the good news is not all PTSD cases have to result in you losing your medical certificate, or even more recently, there's new guidance out in this Guide for Aviation Medical Examiners that allows AMEs to issue certificates on the spot to individuals with PTSD or history of PTSD if they meet certain criteria.
I think oftentimes people are hesitant to put anything on the application because they're afraid as soon as they say something, and this may be a broader overview, but specifically with PTSD, that's it, I'm done, my career's over, or my dreams of flying have been dashed forever because I told them I had a history of PTSD.
Well, if you go to www.reddit.com, you're going to get that flavoring, because the individuals on forums and whatnot, they make out typically as though PTSD is a non-starter, and it discourages the aviation community from pursuing a medical certification with PTSD or some other mental health concern. But largely, in our experience, you're not getting the full context. Sure, there are going to be cases of PTSD that are non-starters for the FAA due to the nuance of the case, because again, everybody's condition is different.
It's like when I did personal injury.
You did?
I did.
Who did you personally injure?
That guy on the YouTube comment section. But essentially, you would have somebody come in and they were in a car accident. They were rear-ended, right? And they had maybe just soft tissue injuries, which, sure, aggravating and can be painful. But it's not the same as maybe something where somebody had to have surgery on, their spine because they had a herniated disc, or maybe they ended in paralysis, right? And they would say, well, my neighbor, he got rear-ended and he got, $1 million. Why am I only getting 10,000? Well, sir, I understand it's, may appear to be similar in nature. You both were rear-ended, but you were hit by a Kia Soul, and your neighbor was rear-ended by a Mack truck, and his car basically blew up in two. I mean, so there are times when you'll have medical histories that, sure, they may both have PTSD, but we got to look at really what the fact patterns are. And I think the people that get on those forums, they might miss that nuance.
Well, can I proffer an alternative theory?
You got proffers?
I got a proffer. The guy that got $1 million had a better personal injury than they had with you.
They should have gone to the other guy.
Yeah. So that being said, the idea is that PTSD is not a one size fits all, and just because somebody else had a bad experience and couldn't get a medical, or had difficulties getting a medical, doesn't mean you can't get a medical with PTSD. So with that being said, jumping into the thought process, I sat on a panel recently.
Oh, really?
That must have hurt.
Tell me.
Yeah. So I sat on a panel recently at the Aviation Lawyers Association conference in Washington, D.C.
Who was on that panel?
Dr. Penny Giovannetti, who's a Federal Air Surgeon's deputy.
Right hand.
She is I think she's the deputy manager of medical specialties. I believe is the title.
Well, she'll call in the next episode.
Tell us what we're on. Yeah. So her and Dr. Peter Lambrow, he's a HIMSS AME in Pittsburgh area, and Kathy Yotis, who is one of our mentors. And
where are you flying this?
Where I'm flying this is that I sat on the panel regarding FAA Medical Certification, and we discussed these issues relative to mental health concerns. And one of the things that Dr. Giovannetti was touting was that they have, in order to help streamline the medical certification process for airmen not having to be deferred and go through the queue of being reviewed, is that they've rolled out this new AME guideline for PTSD. And so what she was getting at, what is helpful to airmen, is that individuals that have a medical history of PTSD and are not receiving any treatment and have had no symptoms in the past 2 years, in theory, will qualify for the AME to be able to issue the medical certificate on the spot. However, those are the prerequisites. You have to have no treatment and no symptoms in the past 2 years. But if that's the case, it takes you to what they call the FAA's post-traumatic stress disorder decision tool for the AME.
The plot thickens.
So if you get past those first two questions, it then takes you to essentially a list of 7 questions that have to be answered with a no. So all these questions have to be answered with a no. And if they're answered with a no and the AME can sign off on that, the AME can issue the medical certificate. So what are those 7 questions? So kind of walk you through that and give you an idea of where things can go awry. So the first one is, the question asks, is there any additional mental health diagnosis other than PTSD, including but not limited to depression, anxiety, ADHD, and substance disorder? So I would say in some limited circumstances, we're not seeing a lot of cases where somebody has been diagnosed with PTSD and maybe doesn't have some other reference to a diagnosis of a different mental health condition in their medical records.
Yeah, a lot of times too, like with the VA award rating decision letters, you'll see where they give a person a percentage of disability, and it'll say post-traumatic stress disorder, and then it'll have in parentheses a whole list of other kind of sub-issues with, I guess, that kind of fall within or a conjunction to that PTSD diagnosis and anxiety.
So it's like PTSD also claimed as anxiety or insomnia and so on.
Yeah.
So that's a pretty difficult threshold sometimes to get past. I will say that I see AMEs a lot executing or exercising. They're not executing people, but they are they are exercising discretion, sort of in whether or not there really is a diagnosis or not. So, but I do see that being something that can trip a lot of folks up. So number 2, is there any history of suicidal or homicidal ideation or attempts ever in the individual's history or individual's life? So that doesn't necessarily mean it's in your records. I suppose the AME could say, hey, have you ever thought about, had suicidal ideation and so on? That's another one that we could see. The reason the FAA is asking about that is because that is sort of a complicating factor for the risk for recurrent symptoms more generally. So number 2 is something that we see relatively frequently. Number 3, have there ever been any symptoms of PTSD within the past 2 years?
You got any examples of
Well,
symptoms?
yeah, it's reliving, avoidance, or increased arousal.
You were a psychology major, weren't you, Alex?
Mm-hmm.
You didn't know anything about that? No. Okay. I believe it's this.
So number 4, yeah, that's right. Has the individual taken medication or undergone psychotherapy for the PTSD in the last 2 years?
That's pretty much
self-explanatory.
self-explanatory.
So if you're taking, Lexapro or
Going
Zoloft,
to counseling.
Seroquel, if you're taking something that, to treat the PTSD, you're going to have to say yes to that.
What's
for
it?
the past 2 years.
Look, what's psychotherapy versus like, hey, I'm just going and talking to a counselor?
I think it's the same thing.
The same thing.
Yes, sir.
They get you coming and going.
The fancy
right.
terminology
So-
for it.
So, number 5, is there any history of the individual being limited by the PTSD in performing the functions of any job, aviation related or not? So, I've not seen that really become a problem very often unless PTSD is really impeding your ability to work. So, I don't think that's something that's typical.
You're missing some important footnotes, though, sir.
Go ahead.
Yeah.
What's that?
Footnote B. Go to footnote B.
AMEs should pay specific attention to cockpit or flight-specific PTSD triggers. As the airmen change jobs or occupation to avoid triggers or due to symptoms, do they have any current accommodations for school or work due to PTSD? Again, I don't see that being a very common issue when it comes down to this decision tool.
Most of the times, the people that receive the PTSD benefits, it was like, hey, I had some issues, several years ago, some nightmares or whatever. And this is a generalization. I'm not saying this is like every time we talk to everybody, but by and large.
We can do our own sound effects where you don't have to throw stuff across the room.
But by and large, I think the PTSD isn't something that is, for some of these people, that is actively ongoing.
Correct. It's number 6. Are there any elements of the history which cause you to question whether the PTSD is in full remission or is of aeromedical concern? So, and then the footnote C is, in the past 24 months, has the airman been given an increase in VA PTSD benefits, or is there evidence of social impacts such as divorce or severe isolation? Now, just because you got divorced, I think that's sort of questionable.
That seems very subjective for like a family medicine doctor, potentially, who's your AME, to make...
I didn't like my spouse cheating on me, so I guess...
I got a divorce.
I got a divorce.
Well, there you have it.
Has your FAA medical certificate been denied? Are you concerned you may not be able to get a medical certificate from the FAA? Are you at risk for FAA action for failing to report your medical history appropriately? Call the pilot lawyer at 1-855-FAA-1215 to discuss your options for getting the FAA to issue your medical certificate and get you flying. We are happy to evaluate your case and discuss with you a plan for presenting your case to the AME or the FAA. Aviation law is all we do, nothing else.
Number 7, the last one is, do you have any concerns regarding this airman or are unable to obtain a complete history? So if you go in there and you say, I don't really know if I've had any symptoms. I don't really know if I've had any medication or psychotherapy. Or I don't really know if I divorced because of my PTSD. Or I don't really know if X, Y, or Z. You're going to give rise potentially to the AME not feeling comfortable with box 7. So
I think this goes back to a general theme, though, that we have is, listen, we're not necessarily trying to throttle information to the FAA, whether it's directly to the FAA or vis-a-vis information provided to an AME. They ask you a question, you answer the question.
truthfully.
Don't guess at the question.
Yeah, don't guess at the question. That's the thing.
The guessing is
Guess
where
is
people really get themselves into more trouble than they need to be in because they said something, put something in motion that they can't possibly disprove because maybe
Yeah.
there's no records to disprove it. And then it's a whole
right.
thing.
So that being said, if you say yes to any of those items, you are not eligible to be issued by the AME. Everything has to fall into the no category. Now, here's a nuance that I think trips a lot of folks up. If you waltz in there and the AME is comfortable issuing the certificate in light of that criteria, and you're issued a medical certificate, the FAA is still going to follow up with what they call an informational request. So in a month, 2 months, you're going to get a letter saying, hey, we need to be able to validate that that certificate that was issued to you by AME, schmiggity-schmop, that you're actually eligible for that certificate and that you actually meet these criteria. So what they'll do is they'll want to see all your treatment records. They'll want to see, more likely than not, a psychiatric evaluation. So and that kind of gets us into the second phase of the AME guidelines. So let's say your AME can't issue the certificate. You're going to essentially get the same letter that you would have gotten if the AME did issue the certificate, just you won't have your medical certificate when you get the letter. So let's say that you go in and you have had treatment and symptoms in the past 2 years. You're going to follow into the second line of disposition. And so individuals that have had treatment, have had symptoms in the past 2 years, continued symptoms, have been treated with SSRI or other medications in the past 2 years, psychotherapy in the past 2 years, the FAA is going to eventually ask for the following. They're going to ask for a personal statement from you. So they're going to want to know, what more about the incidents that led up to your PTSD symptoms, any triggers relative to your PTSD for you to just sort of describe and characterize what caused the symptoms, and so they can sort of ascertain whether or not it's aeromedically significant. They're going to want to know what impact the PTSD has on your occupational, social, or personal function in an ongoing fashion, any modifications that you have to take to your life to help lessen the PTSD symptoms. They're going to want to see a list of medications from you and sort of an identification of what counseling you've had for PTSD. So that's going to be one thing. One thing they ask for is a statement from you. And so that's where, having somebody look at that statement and make sure it's consistent with your treatment records and so on, that's going to be a critical piece because the FAA will look at your medical records and your statement and any evaluations you have and make sure that it's consistent. And if there's something that's inconsistent, they're going to land on you like a sumo wrestler.
Well, you would know what that feels like.
Yeah.
Let me ask you this question.
My wife is actually quite a small lady.
Nobody said it had anything to do with your wife. Are there times, though, when maybe you don't have to provide the personal statement to the FAA?
Lots of times we recommend not providing the statement. What's a statement? If I've sent you all my records and I'm sending you an evaluation from, let's say, a HIMSS-trained psychiatrist, what's a statement from me what am I going to say any different?
Yeah.
I'm just putting words in my mouth.
In theory, I should be saying the same thing, right? You should be remaining consistent.
So what's the difference?
So, yeah, I just had...
Now, I'm sure there are individuals that are out there saying up when someone else is saying down, and there's inconsistencies, and that is problematic.
Right. Yeah, well...
What are you doing?
This seems like opening a door to potentially far greater issues.
What are you getting at over there?
I'm just saying, if somebody was going at this themselves... Like you guys are saying, they're going to start saying up when everybody else is saying down, and it's going to, drag out the process even longer. See, this is why I don't talk.
This is why you're a doctor and not a lawyer. You don't have those fine oratory.
It's painful to listen to.
This is really hurting my ears.
Yeah, it's not painful.
All right, so they're going to ask for that statement. They're also going to ask for a current evaluation by your treating psychiatrist or psychologist. Now, here's where it gets wild. Most people that come to us having a history of PTSD, they don't have a treating psychiatrist or psychologist. I would say almost none of them do. This is where typically we recommend you have an evaluation by a HIMSS-trained psychiatrist.
Well, why can't they just go see their psychiatrist at they were working
could.
with at the VA?
They could.
Why do we got to get another entity involved in this?
Well, it's because...
They don't know my history.
Well, you could go to the VA doctor, sure. I've seen it work. But at the same time, we've had cases where the FAA comes back and say, well, this person doesn't know anything about aviation medicine, the risk to aviation safety, and all they said was they're safe to fly.
Is that how they sound?
Yeah.
Okay.
We got kind of a weird Southwest Southern twang. It's a mixture. This is painful to listen to. Painful to say. It's even more painful to say. So that being said, the HIMSS AME, the HIMSS psychiatrist or the HIMSS psychologist, the FAA essentially is going to know that individual. That individual is going to have an understanding of what is aeromedically significant. And that individual is going to essentially know the process of being able to evaluate the airman medical file. It's a step that the FAA typically likes to see, that they're looking at the same thing that the evaluator is looking at, and so on. So to that end, we typically recommend having an evaluation with a HIMSS psychiatrist if you don't have a treating psychiatrist or psychologist. But at the same time, let's say you do have a treating psychiatrist or psychologist, you want to make sure that that physician or clinician is understanding of what the nuance is with respect to aviation medicine.
What is the nuance?
The nuance is, essentially, what is the level of risk for recurrent symptoms, right? So based off your history, is there a history of suicidal ideation? Is there a history of psychiatric hospitalization? Is there a history of medication use?
Oh, well, I mean, is it just the risk of recurrent symptoms, or is there more to it, like maybe a sudden incapacitation?
Sure. Well, sudden incapacitation would be caused by the risk for sudden or recurrent symptoms. So ultimately, the question is, if the FAA gives you a medical certificate today, what's going to happen tomorrow? What's going to happen the next day? And sort of understanding that history, you can assess that risk. It all comes down to risk, baby. They want to know what is that risk and how can it be mitigated? Does it even need to be mitigated? And so that's where the evaluation from the psychiatrist or the psychologist can look at your history and say, hey, well, he's never had any suicidal ideation. He's never had this or that. So the risk for him having a problem in the future is minimum. And even if he did have a problem, it's only on the 4th of July when he hears fireworks. It's not going to be a problem while he's flying an airplane.
Hey, put that stick down there. I gotta take the pulse of this horse. It's dead. You've beat it to death.
Well, continue beating it.
Move on to the next one.
Number 3, medication list. This is where things can just turn into Harry Carey. Harold W. Carey. So a medication list, they want a list of all current medications, including non-PTSD related medications. Reason for use, start date, side effects, if any. And if currently on an SSRI, it kind of takes you down the SSRI special issuance protocol. But the problem with the medication list is that a fewfold. Number 1, are you taking any disqualifying medications?
You're tripped up right there.
Number 2, have you listed all your medications on your medical application, or are you setting yourself up for falsification action?
That's the FAA putting their foot out to trip you up.
Number 3,
Let's go for some sound effects.
number 3, oh no, number 3 is?
Do you remember?
Let's
number
say
3?
that you are on an approved medication, you have listed it. Is there some nuance to the medication? Is it something that your doctor is going to need to specifically reference relative to the SSRI protocol or some other concern?
Can there be usage of other medications not related to the history of PTSD that may be fine, but when combined with medication, I don't know. Maybe I'm getting.
I don't like this question.
Yeah.
I don't like.
Oh, what do you know over there? You're over there. Yeah.
You're mumbling over there. You're
mumbling.
struggling to put the thought
It's
together.
just Diet Pepsi.
Everybody.
Listen, no. Well, I guess this is probably off the beaten track here.
Here we go.
Path, but
We got a track out here that's been beat.
next to that horse. I suppose what I was thinking of in the back of my head here was, you taking multiple medications that in and of themselves aren't disqualifying, but when combined together create some kind of cocktail of disqualifying chemical.
Well, I guess in some capacities,
but if
with diabetes, you have a situation where you cannot take a certain combination of medication. So
that's probably. I mean, maybe they see that related to other conditions. And again, I guess that goes back to your overall
that's the thing.
point.
Well, yeah,
it's
that's overall. If they're asking for a medication list, and you think, they're just looking for my PTSD medications, you send a list that's a mile long that speaks to all your other conditions. You're taking gabapentin for nerve pain. You're taking something else. Sure, Alex.
Clonazepam for headaches.
Yeah. Viagra. It's going to answer all sorts of questions. And ask them to ask all sorts of
into a lively conversation.
Yeah, wow.
Yeah.
Yeah, well,
Even more painful.
Man,
that was actually a decent thought I had.
Number 4, copies of any PTSD screening tools. So when you go to the VA and they said they'll always give you those screens. How are you feeling today on scale 1 to 5 or 1 to 10, suicidal ideation, depressed, and so on. The FAA is going to want to see that. You can typically get those through your blue button file. Alex, tell us more about the blue button file.
The blue button file is every visit you've had at the VA is put into one record that you can get on the My Healthy Vet website. So it's a great resource instead of having to go to each individual VA center that you've been to request the record, which can take forever. You can just get it right there online.
Now, can you also get your CMP exam?
No, you can't. That's through a FOIA request. Now, we have seen sometimes that some CMP exam information does make its way into the blue button report, but that's few and far between. So the CMP exams through a FOIA request, and that just takes forever. Just good luck finding that, getting that.
Yeah. So the copies of psychological testing is number 5. Can you find that typically in the blue button file?
Yeah, if it's been done,
Yeah, if it's
at
done
the VA, not through the CMP.
It does.
for sure.
It doesn't seem like there's any rhyme or reason to what is in the blue button file, though. Some will be like 600 pages, and others will be like 50.
So if you've never been to the VA for
all
any
treatment.
treatment, then it's going to be every section that you've checked to have is going to be blank, and it's going to generate a blank report that's 33 pages.
I learned something today.
It's unusual.
I thought dogs
Laid eggs.
Number 6.
Painful.
VA administration, Veterans Administration records. So they're looking for VA CMP compensation and pension disability evaluations, VA disability compensation award letters, and VA clinic and/or hospital records. So I'll tell you that these CMP exams, the evaluations that you undertake to get the benefits for VA disability benefits, if you have those are close to impossible to get, it seems like, with any timeliness. So typically we don't see the FAA demanding those if you don't provide that. But they do want to see the treatment records, and you can get that through the blue button file.
And the award letter you can get on that My Healthy Vet website.
You can get that so
Whoa.
easily. Number 7, previous medical.
I don't need a copyright infringement from Young Gravy.
Number 7, previous medical hospital records. So again, it's the the blue button file. Hospital records, if you've had some hospitalization for PTSD, that might complicate your case to some extent anyhow. So that's typically what the FAA is looking at, but looking for records-wise. But generally speaking, our thought process is you want to have this all together before you even go to your examiner, because the proof is going to be in the pudding, right? Those records are going to ascertain whether or not, for the most part, you would meet the first criteria of being able to be issued by the AME. You're going to have to look at these things to be able to ascertain whether or not the AME can issue the medical certificate on the spot. Number 2, having those records together and being able to go to the FAA through the AME or otherwise is going to be helpful. Lots of times what we like to do is make sure that there's no collateral damage in those records. In other words, your blue button file, your VA medical records don't identify some other condition that could be addressed before your exam and that we could potentially argue to the FAA is not aeromedically significant. But definitely having your records together and sending that to the FAA at the time of exam or the time of submission is going to certainly cut down on the time it takes to process your medical application. Because otherwise, if you go and submit your exam, you get deferred, you're going to end up in a spot where you're going to wait 2 months for the FAA to come back, send you a letter, and ask for those things that we just identified.
Well, I see us turning base to final, and I want to just kind of go over some real quick landing procedures. Nobody's laughing. Okay. No. Whatever. Anyhow, real quick, for those out there that have PTSD, that are vets, that have benefits for PTSD, I know a lot of times there's concern that, how is it going to impact my benefits that I'm receiving if I'm telling the FAA that I'm good to fly? Is there any kind of analysis or theories that you have that you can kind of briefly speak to, that, arguments that we try to make as to, you can have VA benefits for PTSD and yet still hold a medical certificate?
So I got called into a very important meeting while you're asking that question. What? Can you say that again?
Oh, geez. Basically,
just answer the question.
I'll answer the question. Imagine my voice is Anthony. What I'm getting at here is typically what we try to argue is that even if you have a history of PTSD and that you're receiving a benefit for it, the VA had an opportunity to first and foremost, evaluate you and make a determination as to whether or not there was any nexus there to your service that should warrant that benefit. But by and large, when it comes to medical certification with the FAA, we're saying, hey, listen, the individual, they had the history of PTSD, but to the extent they had it, to the extent they may still have it, it's not aeromedically significant. And therefore, those two ideas can, in our minds at least, and the arguments we make, can coexist. That you can still receive the VA benefit and still hold medical certification with the FAA, because we're saying
That's right.
it's not an aeromedically significant history of PTSD.
That's right.
That was what I was getting at.
Well, let me
I
say
think-
this last thing.
Uh-oh.
Should you report your PTSD on your medical application?
Well, you tell me.
Where would I report it? I don't know.
Oh, yeah, that's a good one. 18M. It goes to that 18 mic.
For mental health. And
For
if you're
mental
receiving VA disability benefits for the condition, that should simultaneously be reported at question 18Y for VA disability benefits.
All right. Well, there's the chirp of the wheels, and when you land, and you get the little whatever.
Or like a screeching halt whenever you're flying.
Well, it was a crosswind landing, and we ended up on the other side of the runway. Anyhow,
Upside down.
You've logged another uneventful half hour and a little over a half hour listening to the Pilot Lawyer Podcast.
I know it was painful. That had to have been painful.
And even though our wives deny they know us in public, still, we are the Eisen brothers at the Eisen Law Firm. We'll talk to you next time.
This is thepodcastfactory.com.